Ectopic pregnancy is something we need to hear about and very often, but it be very deadly. Today, I will give you an overview of what ectopic pregnancy is. My name is Hilda. Welcome to my channel. This video not for you, yes, for everybody. Whether you don't get ectopic pregnancy before, whether you don't lost a tube, whether you be at risk of getting an ectopic pregnancy, this video not for you. Please stay tuned and we'll be talking about ectopic pregnancy. So, what is ectopic pregnancy? Ectopic pregnancy now when a fertilized egg be implanted outside of your uterus. It could be outside in the ovaries or outside around your belly, but the most common we hear about in an implantation will occur for your fallopian tube. Wait till it actually happen before that kind of thing they happen. People do wonder what's going on, why me? So we'll get a very few courses then we'll hear about them very often from friends and family. People that mostly talk about a blockage of the fallopian tube. That's the main cause of an ectopic pregnancy. Why you get a blockage in the first place? So maybe if it come about from a mucus buildup, you don't get an STD before where you not treat them completely, or maybe you don't get C-sections in the past or other surgeries, pelvic inflammatory disease, or maybe you don't do D&Cs in the past where you don't cause scarring for your fallopian tube. That's when you start, get that blockage for your fallopian tube. But it's okay. You could get treated for it, and that's why I'm talking to you today. Now, which symptoms you get when you get an ectopic pregnancy? Plenty people that get confused between a miscarriage and an ectopic pregnancy. Let me tell you how you're gonna feel. One, you will get a lower abdominal pain. Some people that get bleeding or light spotting, very dark brown blood or spotting. Some people that they feel dizzy. Some people they even get normal signs of pregnancy because it's actually a pregnancy, but it just not be implanted in the right spot. So you feel get that nausea, you feel the vomit, even though they for the right place. You get those symptoms, but it's okay. When you start get that symptoms, not my concern that. For my sisters and back home, I want to tell you this. No hesitate when you get the symptoms. Go right to maybe your gynecologist or any OB triage. Go report. Wait till you feel how you feel. You want to go immediately. No listen for that talk them for quite a way. People that they say, oh, I don't get a similar situation. That's how I feel. I be the bleed. I be get cramping. Then after 2 weeks, it disappear. Everything come back to normal. Now I don't born 3 picking. Then after that, so no be anything where you need to worry about them, my dear. No two people, no they the same. Rush to your doctor. Go see your doctor. Talk to somebody. Talk to a health care professional. No a year say for quarter. Because nothing that we it kill most of our women, our girls. When you don't, I'll tell you a little bit about how your fallopian tube day. This is your fallopian tube. It is this big. When you get that implantation inside of here, what did happen? It grow, it continue to grow, but then your fallopian tube no fit hold that pikin, it no fit hold that pregnancy because it not big enough. There's no space there. So what go happen? It go rupture, and when it rupture, guess what? Internal bleeding. I'm sure by now all we know what the internal bleeding be all about. You know one reach for this level, because by the time you get an internal bleeding, say you day around countryside, they want rush you to a health center say you need to do surgeries before they want take you go general hospital. Now another story. You know one reach for that level. Please, if you start experience spotting, cramping, whether na faint or na dull cramping, go to the hospital. Whether na light spotting, no assume say na implantation bleeding. No assume. Go hospital. Okay? When you reach your hospital, my dear, you get options. You get different kinds of options where it could save you that trauma of maybe losing a child next time. We could save you that trauma of maybe, even damaging your fallopian tube. So you want to go see a doctor immediately for a solution. Now, when you reach for hospital, what do you do? You get options. Some of the options then, maybe your doctor could run a blood work. They could determine if you be good enough for, for them to administer you an injection. Usually they administer methotrexate injection, actually a chemotherapy injection for help shrink the cells them and then, eliminate the tissue. That one, na an option. Another option, they fit decide for just do a DNC and take out the the tissue from, from your fallopian tube. That one will spare you your fallopian tube. However, if the fallopian tube don't already be damaged, say you don't already get a rupture, God forbid, they could maybe do you a surgery for take out one of your fallopian tube then, because usually they occur for, you get two fallopian tubes, it occur for either side, maybe right or left. So if it be happen now for the left side, they could take out the left side. If it happen for the right side, they could take out the right side. So at the end of the day, you still get one for deal with them. Now, after your treatment, after you don't go through all the stress and then you don't come back to normal, what can you do to prevent this? What's next? Now the time where you want, sleep over, you want to go back for your doctor after everything don't come back to normal, after your HCG levels don't come back to zero, you want to go back to your doctor and ask, doctor, what do I do now? And please tell your doctor everything. Again, remind your doctor. Your doctor they see maybe 1,000 of people every day. They don't know your story. They feel just stand for, they feel, sympathize with you a little bit, or that empathy, show you empathy. But you know what? As you turn your back, they don't know who be stand with their front. So you want to remind your doctor what's going on. Tell your doctor again, say, doc, are they at high risk of another ectopic pregnancy? Because I just get one. I don't get maybe 10 C-sections in the past. I don't get surgeries. I don't get pelvic inflammatory disease. I don't get STDs. I get candida, dog. What will we do? I hear, tell your doctor, propose for your doctor options where you don't hear. Tell your doctor, say you don't hear about CAP 4. Maybe your doctor could be like, okay, maybe we want to try CAP 4. Tell your doctor, say you hear about, Anika. Your doctor might want to try that. Remind them of your situation. You know what I mean? I hope I did communicate with somebody. Remind your doctor. That's what you need to do. Stand for your case. Be your own advocate. Yes, that's in the way you get to do. But then don't forget, over-the-counter medications and they for help you too. You want be on top of your vitamin C. You want be on top of your vitamin E. And also plenty of people then go be like, now because say you do for that side, now why do you talk about vitamin E? Vitamin, we don't get money for buy those things. My dear, I go encourage you for day on top of your ginger and turmeric. Those two no go fail you ever. Ginger, turmeric. Get those two and work on it. Okay, those two will help you. And do not forget, we women, they're over fragile. You want day on top of your yearly VGG exams, whatever you call it. Do your yearly exams, check yourself, make sure everything is going on okay. Even if na yeast infection, take antibiotics, treat yourself, take good care of yourself, and this will not happen to you ever again. So I am here to encourage you, whoever don't ever get ectopic pregnancy, who be at risk of, who don't lose a tube, my dear, there is hope. No give up. There is hope. You just need to take care of yourself. Make sure you're protecting, you're getting supplements that will support the function of your fallopian tube. Again, this is your girl Hilda. I'm bringing you the best of videos. Subscribe to my channel if you haven't. I am here to listen to everybody. Your suggestions are also very welcome. Have a pleasant evening.